Today, we're diving into two of the toughest public health challenges facing young people right now: the opioid crisis and the suicide crisis. Now, for a long time, we've kind of seen them as two separate issues. But what if they're not? What if they're actually deeply connected? Well, a major new review that looked at 17 different studies from just the last 4 years suggests they absolutely are, and the findings are something we all really need to understand.
I mean, just look at the situation. On one side, you have the devastating reality of youth suicide. It's the second leading cause of death for kids and young adults between 10 and 24. It's just heartbreaking. And on the other side, the youth opioid crisis is spiraling, with overdose deaths hitting a tragic all-time high in 2021. For so long, we've tackled these as two completely separate battles.
But what if that's been the wrong way to look at it? This new wave of research is asking a really crucial question. Are these two crises actually connected? Could one be fueling the other? And if they are, how on earth does that work? Okay, so here's our game plan for digging into this. First, we're going to really get a handle on the scale of this colliding crisis. Then, we'll look at the hard evidence that connects them. After that, we'll explore the specific patterns that seem to raise the risk, figure out who is most vulnerable, and finally, and this is the important part, talk about a path forward. All right, let's jump right into part one: understanding this collision of crises and just how big the problem really is. So, the bottom line from all this research is pretty direct. The link between young people misusing opioids and suicidal behavior is not a fluke. It's not a coincidence. It is a very real, growing, and intertwined public health crisis right here in the United States. So you might be wondering, okay, how solid is this connection? That brings us to section 2, and this is where the evidence really speaks for itself. And remember, this isn't just one person's opinion or one study. We're talking about a massive review of 17 different scientific papers. This is the number that really stopped me in my tracks. Out of the 17 recent studies they looked at, a staggering 16 of them found a clear positive link between youth opioid misuse and things like suicidal thoughts, planning, and attempts. 16 out of 17. In the world of research, that is about as close to a consensus as you can get. It's just impossible to ignore. And when you look at the actual numbers, you see just how powerful this link is. Look at this top line. One study found that high schoolers who misused prescription opioids had nearly 5 times higher odds of attempting suicide. 5 times. And it's not an outlier. Another study found a more than 4-fold increase among college students. The numbers are just, they're stark. So, okay, we know there's a definite connection. The next logical question is, why? How does it actually work? Well, that brings us to our third section, the specific patterns of risk. And it really comes down to recency, frequency, and using other substances. The research really zeroes in on 3 things that seem to turn up the danger dial. First, there's what they call a recency gradient, which basically means that misusing opioids right now is way more dangerous than having misused them in the past. Second, there's a dose-response effect. The more often someone misuses, the higher and higher their risk gets. And third, polysubstance use. Mixing opioids with other things like alcohol or marijuana, that just multiplies the danger significantly. And this chart here, it really makes that first point about recency so clear. You can see it right there. The studies found that young people who are currently misusing opioids are sitting in that highest risk category for suicide attempts. Now, past misuse absolutely carries a risk, don't get me wrong, but that immediate current use, that is the biggest red flag. So the main takeaway here is really, really crucial. It's not just if a young person is misusing opioids that matters, it's how and when. The more recently and the more frequently that misuse is happening, the greater the immediate danger of suicidal behavior. It's that simple and that serious. Okay, so let's move on to the human side of all this data. That's our 4th section, identifying the kids who are most vulnerable and really trying to understand the disparities here. Because one thing the review makes perfectly clear is that this risk isn't spread out evenly. The studies consistently found that this link between opioid misuse and suicidality was stronger for young women. The risk also falls disproportionately on youth from certain racial and ethnic minority backgrounds, on young people with disabilities, and on sexual minority youth. And this quote from one of the studies is just so telling. It found that even when Asian adolescents misused opioids at the same rate as their white peers, they had higher odds of suicide planning and attempts. And that is such a critical point. It tells us it's not just about the drug itself. It's about how other factors, maybe stigma or lack of access to mental health care, can make some communities so much more vulnerable to the harm.
And you see a similar story right here, this compounding of risk. For a young person who is already navigating the challenges of a disability, misusing opioids was linked to more than a threefold increase in the odds of having suicidal thoughts. It's just a powerful and frankly painful reminder of how these different struggles can intersect and just amplify each other.
So the big question is, what do we do? What do we do with all of this sobering information? Well, that brings us to our final section, forging a path forward. And it's all about prevention, support, and finding some hope.
What's great is that the research didn't just point out the problems, it also points towards solutions. And a huge part of the answer lies in something called protective factors. You can think of these as a kind of shield or a buffer. They're the positive things in a young person's life, like having supported friends and family, or feeling connected and like they belong at school, that help them cope and build resilience against these kinds of dangers.
So based on all this evidence, the researchers basically map out 4 key steps. First, integrated screening. We have to stop treating these as separate issues and start screening for both opioid misuse and suicide risk at the same time. Second, support has to be culturally tailored. The one-size-fits-all approach just isn't going to cut it. Third, we have to actively build up those protective factors, strengthen those community and school connections. And finally, we need smarter policies, everything from better prescription monitoring to making sure life-saving tools like naloxone are everywhere. So, look, the evidence is in. This connection between youth opioid misuse and suicide is real, it's incredibly dangerous, and it's complicated. And that leaves a final question, really, for all of us. Now that we know this connection is real, what is the single most important first step that our community, your community, can take to start breaking that chain and protect our kids?